All right, thank you. Hi everybody. So why are we seeing more and more doctors with their faces in their computer screens or clicking frantically from one screen to another while trying to listen to us to help us with our good health? Imagine your next visit to your doctors and you find yourself with just you, your doctor, face to face without the digital distractions. Hi, my name is Rose Maranathan. I'm the CEO and co-founder of Gojitech, a Canadian health tech startup based in Ontario addressing problems in clinical practice using the latest in artificial intelligence technology. We have made it our mission to make it easier for clinicians to use computers. Over the years, clinics have had to rely more and more on computer systems to do their job. This has led to a type of burnout and the loss of key face-to-face interactions between patients and doctors. Clinicians are spending far too much time working on computers and not enough time providing care for you and me. The problem, simply stated, is that the clinicians are spending on average 6 hours a day on their electronic systems and about 2 hours a day, 2 hours documenting a 1-hour patient visit. This is leading to a loss of time to digital system, which could be instead redirected to care for patients. Lost income for clinics and clinicians, even to burnout of doctors and nurses to the point some are leaving the profession and worse, some are committing suicide. Healing the healers. We believe there's a better way. We are focused on healing the healers and let them get back to their passion, which is providing care to their clients. Our intelligent assistant simply works with their existing systems and software solutions, making it simple to add us on. We provide a way for clinicians to simply turn the mic on and talk naturally with their patients. And our AI transcribes the audio, takes care of the documentation, and all clinical activities in their systems. Our system works with voice, gestures, and even aids in the next best care action recommendations using digital quality measures. Our solution is built with privacy and security safeguards so that the clinicians don't have to worry about meeting their jurisdictional requirements, such as PHIPAA in Ontario, HIPAA in the US, GDPR in Europe. We help by removing what the doctors call today death by 1,000 clicks in their systems, giving back over 200 hours, and even automating clinical documentation without even having to dictate. All of this for a minimal investment from the clinicians of around $60 US per user per month. And clinicians stand to get back about 30 times return on that investment. Our market is huge. We see about 17.5 million users in North America in primary care, acute care, and community care, worth over 12 billion US dollars. To achieve our mission and to exploit this market opportunity, we have assembled a world-class team of founders who have had prior startup experience, exits, including in AI. We have worked with each other in successful execution and are well connected in healthcare to turn this venture into a massive Canadian success story. Our go-to-market strategy is to use channel partners, and to this end, we have signed 3 of them already. And these 3 partners give us well over 300,000 clinicians in North America. We have had strong traction so far. Aside from the 3 channel partners, we've also won a project funded by Ontario Biosciences Innovations Organization to demonstrate our product with 2 major clinics with over 50 plus clinicians to continue our path to product market fit. On top of this, we have secured funding from venture capitalists, Business Canada Innovations, and several grants to hire our team of 15 people. We have a huge pipeline of opportunities with just over 1 to 2% adoption in 2 to 3 years. From this traction, we see about a 2.4 million to 4.8 million US in annual revenue. Our competition is very strong. However, we're very strongly differentiated through our Gojitech as a listening agent listening to the interaction between doctor and patient, and automatically generating all the required documentations, including all the relevant clinical actions, such as if the doctor wants to prescribe, it automatically detects that prescription and creates a prescription for the doctor. We plan to use the funds from this competition to continue our market fit, implement our channel partnership agreements, release our product to one of our largest channel partner, Well Health in Canada, and continue our market expansion and retain staff and hire more data scientists. Thank you, and please join us in reimagining healthcare to enable the clinicians to focus on their patients and healing the healers. Thank you.
Thank you very much, Ro. You did a great job. And I'm sure we're going to have a robust discussion here, and maybe I'll hand over to Lou to kick it off. I'm sure all of us have questions. We'll just keep going in a round until we've answered them all. So over to you, Lou.
Thank you, Jane. Great presentation, Ro. Fantastic business you're building over here. Just curious, across different healthcare systems, people use different EHR systems. On the back-end integration for your software, I don't know how much have you tested across different platforms, and is it compatible across different EHR solution providers?
Yeah, so that's a great question, Lou. Thank you. And yes, we have had tight integrations with Well Health as an example. So they've stood up a development environment for us to do an API-based integration. So we're doing a really tight integration there, right? And Smile CDR is another one where, because it's a FHIR-based standardization and we're standardized in the same fashion, we're able to do yet another tight integration. Point-Click Care have said the same thing, where they want to do a tight integration because the key objective in our solution and our channel partners is that they don't want yet another system that sits on top where the doctors have to then do something more with that data. So we're really doing tight integration and enabling that friction to be removed in how clinicians use our system. Because we're an API-based solution, we do expose that for other clinics or other EHR vendors so that they can then start consuming us in the same seamless fashion. We have no exclusivity agreement with anybody, so that as a result, we can enable that kind of data integration. Now, having said that, we have looked at and explored those partners or those providers of EHR and EMR solutions that don't participate or cooperate well in other innovative ways of integrations with them. We avoid that because of the cost associated with it and the maintenance associated with it. But however, we have the technical capabilities and skill sets to take care of those kinds of scenarios.
Thank you.
Thank you.
Great, thanks. Alex, do you have the next question?
Yeah, I'm going to build on what Lou had said there, and it's interesting that you're using the API-based integration model, but you said that you are proceeding on a non-exclusive basis. So if the partners that you're working with right now are willing to expose the API to you and it's non-exclusive, where is your barrier to entry for someone else to come up with a competing solution? Is it in the front-end AI system that is just doing in your view, obviously a better job of listening to the doctor and doing some natural language processing to figure out what the doctor wants done?
It's a combination. So yes, that's certainly part of what we are focused on. And we're also not focused on just only solving one problem and then maintaining that all the way throughout. So we're constantly looking at how do we do things better and how do we make some of the other workflows work better, right? So things like referrals, how do we automate that from a conversation? How do we complete forms for them automatically, and so on and so forth. Now, the other thing that we do is that with channel partners, we actually do a revenue share so that it enables and ensures that they benefit on our technology with new revenues that they otherwise would not have had. So we do a percentage share to maintain that client and maintain that relationship.
Okay.
I hope that answers your question, Alex.
I just want to flip through to some super basic questions. And the first one is, does it work? And, we've all yelled at Alexa until Alexa tries to figure out what we're saying. how do you know it works, and how do you convince a physician to trust it?
Oh, great question. So right now, as thanks to Canada Innovations Program as well, we've been actually piloting it and demonstrating it with doctors. So in clinical setting in the Peel region, right? And on top of it, our clinicians have been actively working with us on getting our speech to text and AI algorithms actually respond and provide meaningful outputs and outcomes, right? Now, having said that, are we there 100%? Not quite yet, right? So we're still working through and evolving and improving our error rates. And we do still discover some errors, but this is the advantage that we have as compared to our partners, our competition. We're all kind of on the same boat. We're all into the same point where we're making the same error. So the competition is who's going to go to that next stage fast. And we believe we've got the type of skill sets and the base to do that more rapidly.
Okay, can you describe a little bit more about it? I get the sound aspect, but you said it also assesses gestures.
Yeah, so we have. Oh, sorry, finish your question.
No,
sorry,
go ahead. You got it.
Yeah, so one of our thinking is that as clinicians are interacting with the patients, we're trying to ensure that we become less disruptive even in that flow, in that interaction with the patient. So for example, a doctor might have us on their mobile device or on their desktop. And because we have this ability to recommend best care action, what we might do is pop up and say, hey, you might want to prescribe this medication for this patient, right? And then the doctor will see that and they will use gestures to go, okay, do that.
Okay.
Or they'll say, you know what, turn the mic on or turn the mic off so that we can make sure that whatever interactions that they're having with their patient, for whatever reason they want to turn it on, turn it off, they don't have to interact with our system and break that flow. They can use gestures to do the same thing. So that's also to kind of enhance.
Got it. Excellent.
Yeah. And same thing in the context of pulling patient data and such. If they want to skim through, they can use gestures to go through pages, that kind of stuff.
Right. Okay, perfect. I do have more questions, but we'll keep going in the circle here. Lou, back to you. Do you have anything else to ask?
Yeah, just maybe a naive question on the product side. So you obviously capture information during this communication between patients and the physician, and I understand that billing and getting reimbursed for the services is somewhat critical piece for the care provider side. Does the information automatically flow into certain forms or certain formats that the physician can readily submit for reimbursement or all that? Does that flow to that, or still just a Word document? Sorry.
That's a great question, Lou. So yes, so right now, one of the bottlenecks or one of the issues that we've seen with practice and clinicians, and the common thing that we hear from the clinicians is that once they have this encounter, if they decide not to have the computer screen between them and the patient, they take these little notes and then come back to do the notes later on. As a result, sometimes it takes days, it takes hours and weeks, and particularly psychiatry and so on and so forth in those kinds of places, where the billing doesn't happen because they have to finish the clinical notes. So in our world, what we do is we enable the doctors to not only do that automatically, but we enable them to create them in a structured way, right? So now we haven't gone to the point of automating the billing and creating that billing code and submission automatically, even though we've been asked and we're kind of exploring that as the next pathway. But we haven't gotten there because we're still focused on enabling the doctors to take what they say between the doctors and patients and create a structured clinical notes. So we call it SOAP, subjective objective assessment plan. So today, that's another big issue that clinics have is that, and the clinicians themselves have, is that they tend to shorthand because of the fact that all they need to do is just put some sort of a line in to get the billing process happen. They don't focus too much on quality documentation. So we tend to through this process, we're actually making that a little bit better. Well, I would actually argue that we're making it a whole lot better. And then because we do that in a structured way, we're also now doing entity code mapping so that we can go in and say, diagnoses of these kinds have these kinds of codification that you can do to then do better quality measures and quality improvements within your practice. So we go to that next level. So, but we have been looking at and have had chats about making that building process faster and easier, but we haven't gotten there yet.
Yeah,
That's
no,
on our
great. Thank you.
Okay, thanks. Alex, do you have another last question?
Yes, please. So are you now, or if not, are you looking at making the AI engine adaptive to the individual clinician? Because I know a number of different doctors will have different styles of patient interaction, which can influence what they're saying. Are you looking at having the systems be able to adapt to the individual clinician so that they will be better at figuring out what she or he is asking?
Yeah, that's a really good question. Yes, we are. And we actually have some ideas on few IP research intentions with MITAX and University of Toronto's Vector and Mila to talk about some ideas that we have that can actually do that even better. But we are focusing on that. We are actually focusing on even looking at ways in which clinicians can group a set of work together that they commonly do and automate that entirely by just simple utterance, right? So we are looking at those kinds of things for sure. And one of our bigger challenges is accent. So I'll be very honest about that. And we have ways in which to look at how do we deal with that. As you can probably hear my accent, there are certain things in our technology that we see an opportunity with.
Yeah, it's certainly not a new problem, and I'm actually old enough to remember the original IBM voice type system, where you had to spend anywhere from 1 to 3 hours training it in order for it to be able to understand what you were saying.
Yeah, so in our world so far, we're trying to avoid that as much as possible, right? So I don't think we need to be in that space. Thanks to, we're not trying to build our own speech to text recognition software because there's no point. Like we'll lose that bet, right? So we're betting and banking on, Google, Alexa, right? So because they've got such massive penetration, they kind of are already solving that problem for us, right?
Yeah, I would think it's more a question of understanding that one doctor says, okay, let's have a look, and another doctor says open wide, but those mean the same thing, and having the system be able to figure out what each doctor means when she or he says that.
Yeah, agreed. So yeah, we're certainly focused on that.
Yeah. And I think we're almost out of time. I would like to ask just a quick question. Maybe you could give us 3 bullet points of your key differentiators.
Yeah, so as I mentioned, one key one is the ability to just simply turn us on as part of a conversation between doctor and patient. And we start listening in on the conversation and start documenting clinical notes in a structured fashion. Second piece is we codify. So we enable the clinics to take that data and codify it against SNOMED or ICD-9-10 codifications. And then we enable from the conversation all actionable items. So things like if you said you wanted to prescribe something, we create the prescription for you. Or we create the action for prescription. We create the action for referrals. We create the action and so on and so forth, and allow the doctor to simply click through each one to complete the task. And aside from them, we're also, enabling FHIR resource utilization so that the integration to their existing system is seamless.
Excellent answer to recap your company. So thank you very much. Great presentation, and appreciate you telling us your story.
Thank you so much for listening to us. And I look forward to the next outcomes of this.
Thank you.